side. One more. Tip your head back. A little tough on that one. Hi, I'm Dr. Jeff Treadway. I'm a chiropractor here at Bothell Chiropractic in Bothell, Washington. I am here with a patient of mine, Casey. He came into the clinic with neck pain, but he also had something a little bit more severe where the nerves in his neck were pinching enough to cause pain, tingling, and even some numbness down into his arm and even to his hand. Anyway, so he's improved greatly. He initially came in complaining that he's a mechanic and it was hard for him to look down, look up, working on cars, grasping tools and being able to hold on to them. After a thorough exam, taking some x-rays, and during that course of time doing maybe once a month exams just to make sure and monitor how you were improving, which would help us direct our course of care. And as he went through treatment, the treatments got gradually less and less. Anyway, so now he's kind of on a supportive care, just making sure that all the hard work that was done doesn't flare back up. So I'm going to go ahead and take you through an adjustment of what I typically do with Casey. So what I'm doing is I'm just checking the various areas of his neck and back that need to be adjusted. So we're just going through here, checking for movement, anything that feels out of place, tight muscles. Check for general movement of the lower back and pelvis. So with his symptoms coming from the neck and going into his arm, it's the lower neck vertebra that get, those nerves that get pinched and irritated. So we're going to start up at the top of his upper back. And relax there. I'll have you tip your head straight back. Same thing on this side. Right there. Very good. So from this position, we'll typically do a lower back adjustment. So I'll have you lie with this side down. Bring that leg up. Bring that shoulder forward. And then just roll towards me. Good. Most of the time, I'd say maybe 85% of the time, you'll hear a pop or a click. That indicates a joint has moved. But there's that other 5, 10, 15% of the time where you may not hear anything. All that sound is just gas inside the joint that's dissolved in the joint fluid. Comes out of solution, much like when you open a bottle of champagne. It makes a popping sound. But sometimes with a Coke or a beer, it doesn't make a sound. Doesn't mean we haven't opened it. It just means that there wasn't a lot of pressure of the CO2 in there to come out. So this is going to be for his upper mid back, just a little below from the first one that we did. One more. Very good. And then we'll do his neck. So again, we're targeting those lower cervical vertebrae. So we'll get one right here. And I'll have you tip your head back. Very good. One more on this side. One more. Tip your head back. A little tough on that one. A little traction. Loosen things up. So Casey, I'm going to have you sit back up. We'll do your shoulder. So far, how are you doing?
Good. It's nice sometimes when you roll me around like that, my back will just pop before you even push on me, which is great, which is what it's supposed to do.
Initially, that wasn't happening.
Right, it was not.
So this is a shoulder adjustment. It's a very easy way to do a shoulder adjustment. And then I'll have you stand back up here. I'll do your elbow. Very good.
been the best part for the fact of not dropping tools anymore.
Yeah. Can't you do your job if you're dropping tools?
That's right.
All right. How's that feel?
Great.
Looser?
I feel better.
Good.
Better than when I came in.
Good.
Thank you,
Excellent.
Dr. Jeff.
All right. Yeah, you're very welcome. So that was just an adjustment of Casey with his issues with neck and some radiating arm and hand symptoms. If you, a loved one, a friend, family member, whoever, if any of those people or yourself are suffering from neck pain, radiating arm pain, mid-back pain, or even lower back pain, I would love to help you. I'd love to help you get back to your life, to be able to work on your car, to be able to play tennis. Anyways, I would love to help each and every one of you that needs it. Again, we'll do a careful, thorough exam, x-rays if necessary, pinpoint where exactly the problem is, and then give you the recommendations that you would need in order to actually get this corrected. I invite you in. We have a special right now, over $200 off your initial exam, x-ray, and that includes a first adjustment. I want to thank you for watching. It's my pleasure to take care of all of my patients. I wouldn't have done this for 30 years if I didn't think it was the right thing.